Welcome to Lesson 2. In this lesson, we will be reviewing some behavioral interventions that we can use to help patients with ADHD, oppositional defiant disorder, conduct disorder, and other externalizing behavioral disorders. And the verse guiding this lesson is from Proverbs chapter 29, verse 17. Discipline your children, and they will give you peace of mind and will make your heart glad. Some people today think of discipline as a bad thing, when actually, when done with love and consistency, has very fruitful outcomes. A great approach to use in behavioral work with children with ADHD, ODD, conduct disorder is behavioral parent training. Behavioral parent training is a term used in the field to describe the instruction and implementation of behavior modification strategies through the parent. And these are some goals for behavioral parent training. It helps to produce more positive and consistent family interactions. It helps to set realistic expectations for the child's behavior. And it helps to improve the child's ability to manage his or her own behavior and improve parents' skills at providing appropriate and consistent consequences and rewards for the child's behavior. And overall, it will reduce the level of stress for both parents and child by promoting more effective interactions between the parent and the child. There are many different approaches for behavioral parent training. Um, the one that I have used most often is based on Russell Barkley's methods for helping families with ADHD. And the focus of behavioral parent training we're going to discuss includes giving effective commands, responding to diversionary tactics, setting limits, positive praise, a realistic appraisal and use of timeout, and managing side effects to medications as well as stress management. These are all important topics to help empower a parent with a child with an externalizing behavioral disorder. And what is behavior modification? Behavioral theory is the underpinning framework for behavior modification and behavioral parent training. Behavior therapy is based on social learning theory, and it aims to achieve precise therapeutic goals, which are usually either the elimination of symptoms or negative behaviors or the development of desirable behaviors or pro-social behaviors. And we know behaviors are learned. Some of the ways that behaviors are learned are through classical conditioning, which includes the idea that an environmental stimuli causes a response. So think of Pavlov and the bell and the dog, where ringing the bell and giving the dog the treat consistently will cause the dog to salivate just by ringing the bell in the future. Operant conditioning, and we can think of Skinner associated here, is behavior controlled by consequences. And this involves positive or negative reinforcement, but of course, positive reinforcement is much more appropriate and is stronger actually. And so, operant conditioning involves, say, having the dog sit and giving the dog a treat afterwards will reinforce or strengthen that behavior. And just to go over some vocabulary, we have the ABCs of behavior therapy. A is the antecedent. That is the event that occurs just prior to the target behavior. And this is very important to elicit when developing a treatment plan. Now, some antecedents could be placing a demand, asking the child to do something, setting a limit, expressing disapproval, rejection, a social situation. Very frequently, asking a child to turn off the video game is a very common antecedent to some behavioral problems. B is the actual behavior, and you want to describe the behavior objectively. We want to try to take away any stigmas associated with it or pejorative kind of, um, comments. And then C is the consequences. The consequences are the positive or negative responses that occur after the behavior. I always begin behavioral parent training with a focus on play, positive praise, and positive attention. It's important because by the time a child is coming to a mental health provider for help with an externalizing behavioral disorder, there is often a negative cycle going on. Negative behavior and some negative reinforcement by the parents, such as yelling, or other such thing. Remember, the consequence afterwards does strengthen the behavior. Even if it's negative reinforcement, it still makes it stronger. So we have to help to break this pattern and change the cycle. So the first thing to do is to increase pleasurable activities between the parent and child. And the reason for this is to promote positive feelings between the parent and child. They are often in a very frustrated, emotional state where the child's constantly in trouble, the parent's very angry often. And so we want to help to change that and identify some pleasurable activities that they can do together and schedule those and intentionally plan them each day. And it's important because it helps to convey that message to the child that what they do is important. And it reinforces positive behaviors through play. Because remember, positive reinforcement is much stronger than negative. So this will be very powerful. Now, how to play? How to play? What should they play? A lot of adults today are very serious, maybe very busy, working, doing so many things. So, play may be something they don't feel like they have time for in this busy world. But it is important because for a child, that is their work, that is their world. And so, it's important to help the parent understand this. And so, I tell parents the way to play is to be a child themselves, and sometimes it means acting in a way that they think is silly or embarrassing. But it's just with their children. So and to allow playtime to be a give and take experience. Allow the child to take the lead and maybe say what they can choose the activity and follow what they are doing. Playing with the child sometimes means simplifying words so that he or she understands, sitting together on the floor, being together on a playground, going outside, drawing pictures together, playing a board game. Of course, it can be playing a video game, but getting back to the basics here and having some interaction is important. And one of the most important components is to have fun, to enjoy the child, and to enjoy the time together. During this time, the parent is to practice giving positive attention and praise. So the provider, the clinician, needs to help the parent to set up a structure for playtime. We're going to set a time frame for the playtime. You're going to review rules of playtime, such as if a timeout is required during playtime, you're going to go back and complete the play activity after the timeout is completed and processed. So this is a very important component. I can't stress it enough. It might sound like it's silly, but it's not. And again, positive praise, play, and positive attention has to come first before the other correction can occur. Parents also need instruction in how to provide positive praise. They are instructed to be on the lookout for when the child is doing the right thing. Oftentimes, the child gets a lot of attention from the parent when they're doing the wrong thing, but not much attention when they're doing the right thing. So they need to, again, here be intentional about this, catch them being good, doing the right thing, and to try to praise the child throughout the day for things that you like and things that you want to see more of. And here are the specific instructions for how to provide positive praise. State their name and describe the behavior you are praising. John, you are doing a great job with your homework. Include some physical contact, such as a pat on the back or a hug. Eye contact is also appropriate here as well. Set a goal of providing positive praise at least 3 times a day. I always give parents homework to journal the behavior and the type of praise they provided. This will reinforce their behavior. Keep praise specific, describing the actions of the child rather than stating good boy or you are being good. So keep the praise specific, letting the child know specifically what it is that the parent is appreciating. The next area of instruction includes giving effective commands. A command is an important communication tool that gets things going or stops something. Sometimes communication styles between the parent and child have gotten um, out of hand or kind of negative. And so it's important to help the parent with their limit setting and giving effective commands. And so I instruct the parent to be aware of the exact task they want the child to do. And always important with behavioral therapy is use a neutral, matter-of-fact tone of voice. Using a stern or angry tone of voice can be negatively reinforcing. So, a neutral, matter of fact tone of voice, and follow through with appropriate praise or consequences in a consistent manner. Support or back up the spouse or other caretakers when they are giving a command. And of course, we know family dynamics are so important. If one parent is undermining the other, that's going to reinforce behaviors as well. And so here are the steps to give effective commands. Get your child's attention by going to your child or have them come to you. Establish eye contact. It's helpful to say the child's name, pausing to repeat the child's name until he or she looks at you. Then reinforce that by giving your child praise for attending to you. While keeping eye contact, state your command. Be short and specific. For example, it's time to pick up your toys now. Never ask a question unless you will accept a yes or no as a suitable response. Now, I see a lot of parents doing this. Do you want to pick up your toys now? Johnny, will you pick up your toys? So that would be ineffective. It's time to pick up your toys now, John. So that would be more effective. So never lecture or make negative comments when stating a command. Again, it's just very short and to the point. Have the child repeat the command to ensure they understand. It's time to pick up your toys now, John. All right, John, what is it that I just asked you to do? Johnny will likely say, you asked me to pick up my toys. So praise the child as soon as any attempts are made to comply. Great job picking up those toys, John. Johnny, put your clothes on now. When Johnny starts to get dressed, good, you have your shorts on. Diversionary tactics will often occur in response to an effective command or attempt at limit setting. A diversionary tactic is when the child turns your attention away from what you want them to do. For example, mom says, Billy, pick up the blocks now. Billy says, I want a glass of water. Or, oh, I don't feel good. Or, Mommy, you're mean. Or, but they're not mine. So we will talk about how to handle diversionary tactics. The solution here is to use the broken record technique. Just simply repeat the command. It's important to ignore the diversionary tactic. It's also important to continue to use an assertive, firm, but very neutral tone of voice. All of these techniques that we use for behavioral parent training are also important to use in the children's crisis inpatient unit when starting to do some behavior modification there as well. Another approach that can be used to teach parents in behavioral parent training is the use of warnings. Warnings are a type of a command that are used to stop intolerable behavior. When a warning is given, it's important to state the intolerable behavior as well as the consequence. For example, Johnny, you have a warning. If you continue to throw blocks, you will need a timeout. Or, this is a warning. If you keep yelling, you will lose your star for today. Now, it's very important that the consequence that is being expressed is something that is reasonable. And as well, it's important that it is consistently enforced. Otherwise, future warnings will become less meaningful. And limit setting is another important tactic used for behavioral parent training, as well as used in the therapeutic milieu in working with children. It's important to provide structure. It helps to increase parental control, and it increases the awareness of the behavioral expectations for both the parent and the child. And it increases compliance by the child and sets realistic expectations. It's important to explain expectations to the child prior to an event or activity. Review the behavior that's expected as well as any incentives for compliance or consequences for noncompliance. For example, if a parent is taking a child to the supermarket, Johnny, it's important. I want you to stay in the seat in the cart while I finish shopping, and you do a good job listening. When we get home, you can play with the tablet for 20 minutes. If you don't stay in the seat, then you will not be able to play with the tablet for the rest of the day. It's important to have the child repeat back what you have said again to ensure that he or she understands what is expected. Again, just as with commands, it's important to follow through with all consequences and incentives. The parent or the caregiver will not be taken seriously if they do not enforce those. Whenever possible, state in positive terms what behaviors you expect to see from the child rather than what not to do. So in our example, we said, Johnny, stay in the seat and do good listening. Rather than don't get out of this seat and don't talk back. So you want to express what behaviors you want to see. It's okay to include what not to do, as long as you have stated the positive as well. Sometimes specific provision of expectations of what not to do can be helpful as well. But just as a rule of thumb, stating things and goals in a positive way is more helpful. Be consistent. Again, consequences and incentives must be enforced consistently. And it's always important to use limit setting before starting a new activity, such as in the car, going to the store, going to the park, before meals, or before the bedtime routine. And here are some limit setting examples. At the birthday party, you must share toys with the others and you will have fun, but no fighting. If you hit any other children, we will leave the party. So you see here's an example using both stating in the positive as well as inclusion of very specific things of what the child must not do. Another one, it's time to eat dinner. You need to stay at the table until we are all done. If you get out of your chair before we are done, you will lose your star for today. And let's get ready for bed now. You need to brush your teeth and put on your PJs. If you can finish this in 10 minutes, we can have an extra bedtime story. If you do not follow directions, you will need a timeout. I hear many parents coming in and telling me, oh, I tried timeout, it doesn't work. Timeout is very effective, but just like the other approaches, it needs to be very structured and consistent. And so I'm going to go over some steps for teaching timeout or using timeout in the inpatient setting. Timeout is a way of reducing specific behaviors by the removal of all positive reinforcement. So, timeout is meant to be the removal of positive reinforcement rather than negative reinforcement. It's not meant specifically just to be a punishment, but it's meant to remove that positive attention. By removing the child from the situation and placing the child in an area devoid of positive reinforcement or attention, it can help to again stop that behavior. It's important to discontinue engaging the child at that point. And that's important to help parents to see that once the timeout is initiated, that they need to ignore the child. And there does need to be a time frame. A good rule of thumb is a minute per year. So a 5-year-old can have a timeout for 5 minutes, a 10-year-old for 10 minutes, and the timer doesn't start until the child is sitting in the timeout chair. A warning should be given before the timeout so the child can develop a cause and effect relationship to the behavior and its consequence. If you continue to fight with your sister, you will have a timeout. It's important to have a timeout area identified in the home that can be used consistently, and the timeout should be given immediately upon noncompliance with the warning. 3 to 5 minutes for preschool age, and then 10 minutes for school age is another suggested rule of thumb. And you can set the timeout chair in a quiet area devoid of toys or TV, such as the kitchen or dining room, where the child can be monitored by the parent. And the parent should set a timer, such as an egg timer, oven timer, or on their phone, as soon as the child starts cooperating with the timeout. So as soon as they're sitting quietly in the chair, let them know, okay, I'm starting the timer now. Processing the timeout at the completion of the time is very important. After the timer rings, it's important to process the behavior with the child. What was the reason for the timeout? What behavior should have taken place? What will the child do now? And then praise the child for cooperating with the timeout. Okay, Johnny, how come you needed to take a timeout? I was fighting with my sister. Okay, well, what should you have done? I should have shared the toys. Okay, well, what are you going to do now? I'm going to go play with her and share. And then praise the child. Good job, good timeout. Now, sometimes during the course of the timeout, the child begins becoming uncooperative, might get out of the chair. And so at that point, it's important to stop the timer and let the child know the timer will not begin until they're back sitting in the chair. Now, it's important to have some backup consequences for refusal to take a timeout, and then review these with the child on a regular basis. Again, timeout, it's not that difficult. It's much easier to just do your timeout, do your 5 minutes, because if you don't do your timeouts when I tell you, you will not be able to play on the Xbox, um, or whatever other consequence there is. Another important concept in behavioral therapy is extinction. Extinction involves ignoring inappropriate behaviors. And just like the term sounds, extinction involves wanting to get rid of something or, make it disappear. So, and it is used to decrease inappropriate or ignoring annoying behaviors that you do not like. It is not to be used for inappropriate behaviors that are intolerable. So you would not use ignoring for hitting um, siblings, fighting. But you might for some arguing. Now, parents' words and actions teach a child whether his or her behavior is acceptable or not. Ignoring a behavior gives your child the message that this is a behavior I do not like. It's a nonverbal cue that sends that message. But ignoring only works when it is used with positive attention. It must be followed up with positive attention. So when the behavior occurs, um, perhaps a child is whining and demanding a snack, and the parent is using some extinction, so they're ignoring. As soon as the child asks in a nice voice and says, please, may I please have a snack, mom, then immediately respond with that positive praise. Yes, yes, I like when you ask using manners. I like your voice, I like your manners. The more time your child behaves the way you like, the less their time there is for behaviors you do not like. So together, ignoring and praise are very powerful. So the steps to teach a parent when using extinction is to identify a behavior that they don't like and want to decrease. So this is your behavior plan you're creating. And then the parent is to give no eye contact with the child when he or she is exhibiting that behavior. The body language should give the message that you are not attending to the child. No smiling, speaking, or touching. To help control emotions, because parents may start to get upset, encourage them to take a deep breath and tell themselves to relax. As soon as the undesirable behavior stops, could be a temper tantrum, or when the behavior that they want starts, again, praise the child. Now, this is so important. When starting a behavior plan, it is very common that the behavior will first increase. It will get worse or more frequent before it decreases and then stops. And so if a parent was not told this, they might go ahead and try the behavior plan. And when the behavior gets worse, come right in and say, it doesn't work. It's not working. However, when they are prepared, and this has happened to me many times, the parent will come in and say, yeah, just like you said, it got a lot worse, but then it got better. The nurse practitioner can help the parent to set up a home behavioral plan. And sometimes people think, oh, this is bribing the child to behave, but it's not. Kids with ADHD have an impairment in the executive function of the brain, and that regulates things like internal motivation. So, seeing the goals or target behaviors in writing are helpful, and having them in a star chart can be helpful. Using pictures for children who are unable to read is important. So, having a picture of brushing teeth, having a picture of sitting at the table eating, and reinforcers that involve special time with the parents are encouraged. So, parents are so important to their children, and children love getting their attention. Again, even negative attention. So, special time with parents is a great reinforcer or incentive. And it's important to avoid the frequent use of materialistic reinforcers, such as toys, as well. They're very expensive anyway. And then kids can start to decrease appreciation for their worth. These kinds of incentives are best used for a long-term goal. So you set daily, weekly, and monthly incentives so they can be working towards a larger toy or something like that. Star charts usually set up, Sunday through Saturday, and they're important for young children to target very specific behaviors. Point systems are better off used for school age children to promote cooperative behaviors at home. And adolescents, a behavioral contract will be more effective that targets special problem areas and addresses privileges and or allowance. You want to determine a reward schedule with the child. The number of stars equals what incentive? Otherwise, they're meaningless. Or the number of points for the day equals what reinforcer? So it's important to update or change goals as needed and keep it interesting. But most important, be consistent. Inconsistency in the home behavioral plan does make it ineffective. There's a lot of interest in the use of dietary treatments or dietary supplements for the treatment of ADHD or behavioral disorders. Some have some evidence to support them, um, limited evidence, though, if that, and others, no evidence at all. So, some common approaches include the exclusion of artificial colors and preservatives, the restriction elimination diets, the oligo-androgenic diet, supplementation with omega-3 fatty acids or vitamins, micronutrients, or probiotics. Behavior therapy is not the only non pharmaceutical approach for treating ADHD. There are other psychosocial treatments, and those include other types of behavioral interventions, such as um, cognitive behavioral therapy and cognitive training. Neurofeedback is another approach, and school based interventions are important as well. And that can include setting up accommodations, setting up visual cues, um, different contingency plans with positive or negative reinforcers. And so I hope that you utilize behavioral parent training. Is very effective. It's important. We can't really just take the child out of the home, even hospitalize them and provide some behavioral therapy there, medication, and then have them go back home and expect that things will maintain. Without behavioral parent training, there can be that revolving door cycle. And so it's an important component, should be initiated at the inpatient setting and followed through in the outpatient setting, or when first diagnosing a patient with ADHD or ODD, implementing a behavioral plan at that point to prevent escalating or worsening of behaviors.